Next, we're going to move on to HBOT, Hyperbaric Oxygen Therapy, and we're going to get some good information from Shah Haq.
How is everyone doing today? Fantastic. What we are going to be bringing here is the hyperbaric. So what I'll do is I'll go through the brief history of hyperbaric, how it started. It's a very old technology. Would you believe that it started in 1600? So let's go over the brief history of hyperbaric. So the evolution started once again in 1660, which is a really ancient technology. At that time, even oxygen wasn't discovered. The oxygen, as we know, was discovered much later, approximately about 112 years after hyperbaric chamber was first created. And then 112 years later, we finally came to know about the existence of oxygen. So apparently, during the time of the discovery of the hyperbaric chamber, he was basically trying to address the respiratory issues. And he called it the domicilium, which comes from the Latin word, well, actually domus, domicile. And then he treated some of his patients who he believed had the issue with the respiratory system. 1660 was the discovery. And from that point onward, there were multiple individuals from different countries who made the contribution in hyperbaric chambers. The major contributors was, of course, the Henshaw from England, and there were a few other gentlemen who also made the contribution of developing the hyperbaric chamber to its maturity today. So the major players, of course, that we know of today, the father of hyperbaric would be Dr. Burt, and he is the one who basically modernized the chamber in its current form. And then US Navy came into the picture, and US Navy, for their divers, made few developments, did a lot of research on decompression sickness. And from that point onward, it became like, poof, it exploded. So today what we have, which started from 1660, is a perfect combination of medicine and engineering. Now, Dr. Yeager said that we are physicians, we are not technicians, and he wished that he were because he could solve a lot of his patients' issues. That's a very humbling statement. We are engineers, we are not physicians, but we work with physicians to bring about a perfect solution between medicine and engineering. You know of many technologies today which are a perfect marriage between engineering and medicine. What are some of the things that you can think of? A perfect marriage between medicine and engineering. MRI, CT scan, how about pacemaker, cochlear implant, which is taking literally a sound wave and then converting that to an electrical signal and delivering it to the auditory nerve. There are a few other examples that I can think of. The neural control, the prosthetic limbs, that would be another perfect example. With one's wish to just engage, even though they have lost their ability to move, people are moving things. So those are the perfect marriage between engineering and medicine. So the good news is the hyperbaric chamber that we have, there are already some indications that are approved by FDA. There are, I believe, 13 of them. By the way, this is our chamber that we designed right here. So this would be a 2.0 ATA. Imagine what almost normal baric chamber in 1660, this is the evolutionary path today. So this thing goes up to 2.0 and it can comfortably sit 4 people. So let's just move forward and show you the FDA, the indications that are approved as of today. So these are the FDA indications: decompression sickness, gas embolism, carbon monoxide poisoning, crush injury, compartment syndrome, non-healing wounds, and then a few more. Gas gangrene, severe anemia, large burns, carbon monoxide. And then I believe there are a couple of more that I did not mention here, which are also the indication. The post-radiation is not mentioned here, the tissue damage, and then skin graft, that is also not mentioned here. So let's take a look at the emerging opportunities of hyperbaric today. So besides the FDA-approved indications, there are reported results in the following areas: the traumatic brain injury. A lot of athletes are using it to prevent traumatic brain injury. In fact, we have worked with the world champion Canelo Alvarez. He's the boxer that everyone knows about. He is using it for his prevention of possible TBI. The other emerging application where reported benefits have been known for some time is the surgical healing wounds. A lot of plastic surgeons are using it today, be that the plastic surgeons from the plastic surgery mecca of the United States, which is Newport Beach, California, to Houston, Texas, to Florida area villages, as well as in New York. PTSD, that's also another big thing. A lot of our veterans are coming back traumatized from war and whatnot. They too are using it. Alzheimer's disease or other, cognitive function. The Parkinson and Alzheimer has also seen quite a bit of rise in this application. So there are two primary scales that are used in Parkinson and two primary scales for measuring also for Alzheimer to determine the cognitive decline. And in both scales, it has been seen that there are some benefits. So even though they are not approved by FDA, they are not cleared by FDA, but nonetheless, there are benefits that, doctors are mentioning. Migraine relief, that's another one. Chronic fatigue, fibromyalgia, autism spectrum disorder, stroke recovery, multiple sclerosis, Lyme disease, immune system support, and post-COVID or long COVID related issues are also addressed by the hyperbaric treatment. So these are the two case studies, the diabetic foot ulcer and study on chronic wound management at DDRC in England. Our most popular are usually used in the 2.0 chamber. So here we have the 2.0. It's a progressive control unit, meaning you can vary the pressure from 1.3 all the way to 2.0. These are the supporting hardware, and here you have the counterpart, which is the soft shell side. The difference between the soft shell and the hard shell would be, in my mind, this is basically mild hyperbaric. You really couldn't call it hyperbaric. And here you are taking it to the next level with the increased pressure. And with the increased pressure, you get to enjoy the compressed oxygen molecule at a further tinier volume. So this is where, once again, the engineering and medicine comes together really well. When you take a gas molecule such as oxygen and you compress it in a tiny volume, that tiny volume of oxygen molecules that otherwise would not be able to pass through tinier capillaries through the body, in its compressed form, now it would travel through the tinier capillaries throughout the 100,000 kilometer of our capillary network. And it is precisely that compressed volume of oxygen molecule which is being taken advantage of to get that benefits. When you are in 1 atmospheric pressure, your oxygen concentration in blood plasma is very little. It's 1.5%, and rest are basically from the hemoglobin. But when you're taking that hyperbaric session, the compression of that oxygen molecule from the ideal gas law is now allowing you to have a much higher dissolve of the absorption of oxygen molecules into the plasma. For instance, normally, let's say you would have 0.3 milliliter of oxygen in 100 milliliter of oxygen. That's normal baric pressure. But when you're under compression, let's say on a 2.0, it would increase tenfold to 3 milliliter per 100 milliliter. So that's a significant increase. For 3.0, that would jump up to 6 milliliter per 100 milliliter. So if your patients can support, based on their eustachian tube and no further discomfort, you might want to consider 2.0 or greater. And according to Dr. Shah Haq, Tel Aviv University, Segal Institute of Hyperbaric Medicine, all his research papers were done also on a 2.0. Through that, he was able to see the telomere length increase. So this is a 2.0 machine right here. So as we are developing more technologies into this hyperbaric chamber by doing the perfect relationship between medicine and engineering, there are a whole lot of new frontiers that are opening up. And these frontiers are the sports rehab. Many professional players are using it. In fact, we are the ones who are providing the chamber and the hyperbaric solution to their director of sports medicine for New York Giants, New York Yankees, Pittsburgh Penguins, San Diego Padres, Minnesota Twins, and many others. Also, we're noticing quite a bit of uptick in the trend in plastic surgery. A lot of plastic surgeons are now embracing the hyperbaric chamber simply because they have seen the faster recovery of the wound. The most common would be the neck up and neck down plastic surgery, where people, after the surgery, due to the massive discomfort, can't really go into a chamber that is not upright. So that's why you have the upright sitting chamber, or the upright comfortable kind, where plastic surgeons are putting their patients immediately after the surgery to this chamber for a faster healing. So this brings me to the next opportunity that we should look into, and that is the business opportunities through these hyperbaric chambers. Now that this is becoming almost a mainstream, the question is, will the physicians continue to have this increased rate of hyperbaric usage and turn them into business opportunities? And that's where we come in working with you. A lot of you have, successful business practices. All we are asking is this, that take a look into the model that we have that is best suited for you, and then we can take that into a business opportunity for you and your clinic. So when you add the hyperbaric chamber to your practice, what are some of the things that you could possibly expect? You could have the increased patient satisfaction because you have the hyperbaric therapy, which is offering a unique solution for that in a particular application, whatever that may be for that patient. And now they have the option. And then you also have the enhanced recovery times for various conditions just by taking advantage of this compressed oxygen molecule that will now travel through your body. You're also going to be differentiating yourself from the rest of your competitors. And then if you have the additional services already in your business, then you can cross-sell the hyperbaric into your practice. And then, of course, there are long-term revenue potential. When you use this, of course, there will be a sustainable solution in terms of your business model that you have in mind. So let's talk about some of the business opportunities that you could have possibly from the hyperbaric chamber. So I've basically taken the chamber pressure. So that would be 1.3. It's really not much. It's about 32 kilopascal, only 30% higher than normal atmospheric pressure. Then this would be 50% higher than normal atmospheric pressure. And this would be double, 100%. So what are some of the rates that people are charging, the doctors are charging, or clinics or wellness centers are charging? So the average cost, by the way, this is based on the Midwest where I am located, Chicago area. So average cost would be $60 for 1.3, and $75 would be for 1.5, and $100 would be for 2.0. Now, according to Dr. Shah Haq, who recommended the session of 3 to 5 times, now that turns out to be 3 to 5 times a week. So let's say you're doing 5 times a week. So your revenue potential is $1,600. Let's say someone did not adhere to the recommended dosage of or usage of 3 to 5 times. Let's say they only went half of that. Just imagine. So this would be on a session based on the recommendation, and that is the potential if they adhere to that recommendation on a yearly basis. Let's say they did not even adhere to the recommended usage and they went half of that. We're still talking about $10,000. And when it's a 2.0, we're talking about 25. Let's say it's half of that, which would be 12 and a half. So there's quite a bit of potential. Now let's take a look at the same map in another part of the country, and that is in other coast, the East Coast. And here the cost is also going up because of the cost of living and so on and so forth. So this is on a yearly revenue on a per client basis. Imagine you have 100 clients, or you have 150 clients that you have managed or you have partnered with. So there's a tremendous opportunity for having hyperbaric incorporated into your business. And here's the same thing for Pacific Coast, which is significantly higher for a 2.0. So yes, there are potential revenue that one can consider if you already have a thriving business. Why not add the hyperbaric since there are so much opportunities? So that's pretty much what we are asking the business owners, doctors, surgeons, clinic owners, wellness centers. Take advantage of the opportunities that we have right now. The market share right now is $4.4 billion. And the projected market share would be $7.8 to $8 billion by 2035. So far, it has enjoyed a double-digit growth in the entire United States, which captures the 35% of the market share. That's a huge market share, speaking globally. So the double digit will continue to be so until year 2034. And after 2034, the projection is that double digit growth will come down to a single digit growth. So just let that sink in, the tremendous opportunity that you have with the hyperbaric sessions. So this is some of our multi-chamber, multi-individual. Here you have the 2.0. This is not the extended kind. It can sit comfortably 3 people. Here you have the 2.0, and this sits 4 people. Here it's the same thing. And this is the model that New York Yankees, New York Giants, and Pittsburgh Penguins, they purchased. This is the one with progressive control. It has plenty of safety features built into it, and we had to design it in such because there could be some individuals who are simply claustrophobic, and they just have some sort of psychosomatic response being in a confined environment. And you have seen that some people react, when you put them into an MRI machine. So as engineers, what we've designed in this chamber is plenty of safety features, just in case someone is having such responses. We have built into features that would allow them to get out of this thing and be out in the open. And after that, if their condition persists, of course, have them checked by a physician. The pressure that we incorporated here is also variable. Why is that important for a doctor or a business owner that it should be variable? The reason for that is your eustachian tube and my eustachian tubes are not made identically. And on top of that, when you are lying in this position, your utricle and saccule may or may not be able to bring your middle ear to a state of equilibrium. So with that, what we've done, we've incorporated a variable pressure starting low, such as 1.3. And then as the person is getting used to it, then you get to increase it with a single touch of a button right here on the external control panel. Go to 1.5. Once they get accustomed to 1.5, bring them to 1.6, and so on and so forth. So you don't do it right off the bat because you may be a Navy diver or you may be a fighter pilot. That's perfectly fine the way that you have lived your career. But you and I, as normal human beings, just laymen, we may not be able to withstand that kind of pressure all at once. So you need to build them gradually. And by doing that, you are getting accustomed to that pressure. And then as you depressurize, you don't have those queasy feeling and saying that, I don't really feel well. Here you have the soft shell. If you have the wellness center that are just simply treating, let's say, the neurological issue, radiculopathy, or so on and so forth, but that won't have the telomere length increase benefits on these soft shells, simply because it doesn't go really all that in pressure. What do we do with the business that we deal with, or medical practices or clinics that we deal with? Well, we help them strategize your hyperbaric business that you have just incorporated. So our principle is basically identify your local market, and we do that by using artificial intelligence. Again, a perfect marriage between medicine and engineering. We help you develop your own plan. We work with you, and then we figure out the analytics needed for you to be successful. So we run the analytics based on your area of business, not just a random area. For instance, we had worked with 2 board-certified anesthesiologists, Dr. Gallegos and Dr. Langley from Houston, I believe. And they were very skeptic. They were quite apprehensive by saying, Shah, well, I'm not sure whether this would be a successful business. So what we've done, we created a model for them. We ran the analytics, understood their local market demand. We helped them price package the hyperbaric services. So a lot of you are coming here not knowing a single thing. I mean, you folks are some of the smartest folks out there in your respective field, but you just don't know how to price it. So we come in and we help you price that package, be that an introductory package or a segment that you have in mind. And based on our data, the analytics, and then the result that we find through running this AI, we come up with a model for you. And those are the models that we ask you. And then we work together like a team to help you figure out, what works best for you. And then also Needless to say, provide the continuous education as we come up with different models and we develop new features into the chamber based on what we hear from you. We listen to you carefully. If you have any issues that, whoa, our patients are not loving this feature, can you take that out? Sure, we will look into it. And then we get right back to our drawing board and we take that feature out. Or you may say that, hey, some of our patients are saying that we need additional features into this. For instance, we developed the dual action air conditioner. PV is equal to nRT, ideal gas law. Everyone, one of you who took basic chemistry in university would know that. As the temperature pressure is increasing on the left side of the equation, so would the right side variable of T on the part of the equation. So what do? While people were using a single source of air cooling solution, we were looking into dual action AC. Your patients after invasive surgery would already be quite uncomfortable and they would have a burning sensation regardless of what kind of surgery that they had gone through. So we listened to you and we created the dual action AC. We put an internal condensing unit as well as external compressor. So we work together working with you and figure out new features that we need to add. In summary, we do the strategic business consulting with you. We provide the hyperbaric chamber for you based on your particular need, and then we do the staff training. You are busy as is. Your business is running successfully and you do not have time to mess around. So who do you call? Who do you get trained by? Either it's me or Michael Carroll, our CEO. We provide the training for you, or we arrange the training materials that's needed for your operators, for your staff. We recommend what you need to have in order to have a business continuity and business resiliency. Your successful business cannot be down. You have to have the right amount of staff who are running the business, especially for hyperbaric operations, and it has to be run safely. So we train you with your staff training needs. We would have the primary, we would have the secondary train, and we'd also have a tertiary. That is our model, primary, secondary, tertiary. We do all of that. And then on top of that, the hassle-free maintenance. The biggest concern that doctors and surgical centers and clinics have is, I don't have time. I don't have time to muck around with this machine because something went wrong. Well, that's where we come in. We do the hassle-free maintenance for you. It's like a clockwork. The automation basically tells it's time to call this clinic, it's time to call that clinic, it is time for their maintenance service. This component wasn't changed or this component wasn't replaced. This filter needs to be changed, the high density filter, the low density filter, and so on and so forth. So we take those hassle from your mind and we take that responsibility. So you could run your business seamlessly. The marketing support, price packaging, and so on and so forth. We also do the financing solution. For instance, you have your financial objectives where you may or may not have taken into the hyperbaric business startup. So we will finance you for qualified businesses. So now we are taking your financial concerns, the cost of implementing the hyperbaric from your plate, and you put it into our plate. We talked about the continuous education. And these are some of the soft side chambers. This is not quite the type of chamber that you would put a post-surgical patients, because these are for actually sports performance usage. So these are some of the pictures of the soft shell that we have. The limit would be 1.5, starting with 1.3. 1.3 is really not that much. It's only 30 kilopascal, 32 kilopascal. When you go to 1.6, 1.7, 1.8, that's when you get to see the benefit. So the soft shell, just know that that's for basically maintenance, and it really may or may not provide the needs for your patients or your clinic members. It is the hard shell that we recommend for the potential anti-aging benefits, the reported ED issues, the reported collagen skin issues that people have found the benefits of. More soft shell. Here is the interior of the hard shell. So you have the two sitting arrangement here. Let's say your nurse is needed simply because the patient is nervous immediately after the surgery. So you can have your staff member sitting here for the first few sessions. And then after your patients are comfortable, then you can sit them here. You could do a single person operation And these are fully customizable based on what you like. There is a plastic surgeon that wanted a motorized lazy boy. And yes, we made that happen. He insisted that he needs to have a motorized lazy boy for his patient's comfort. So we went back to the drawing board, we made that happen. So it is that customizable. Whatever your needs are, we can make that happen within limits, of course. I love this picture. It's almost like a business class in an airplane, and it's your private suite. So this is some of the luxury models we have. These materials are sound absorbing materials. So they are known to absorb up to 60 decibel in the fastest form that you could possibly think of from the engineering perspective. Why is it needed? Well, your patients after an invasive surgery wouldn't want to feel the tin can feel. That would trip them or probably could cause them some sort of anxiety or possibly psychosomatic response. So we picked the materials that is best known to absorb the sound of up to 60 decibel in the fastest of time frame. And now with that, this diamond quilted material, you don't feel like you're sitting inside a tin can. Rather, you're inside a perhaps living room. And of course, your legs extended and you're watching your favorite show on Netflix. Yes, we made that happen. It's got a smart TV. So provided that this is connected to your Wi-Fi router, you could literally take your cell phone and watch Netflix and or Hulu, your favorite show, right through here. There's our showroom, again, with different models. Oh, this is an interesting model. There are many doctors who said, well, we have patients who are wheelchair bound. What can you provide? So we came up with the solution of this ramp, and then off you go, the Drive Medical typical wheelchair and into the chamber. Oh, by the way, anything that you see, be that soft side or the hard shell, they're all self-sustaining, meaning you as a proprietor, at the end of the day, if you want to use this chamber, you wouldn't need an operator. So anything that you can do from outside, for instance, here is the control panel, you should be able to do it from inside. There's a complete replica of the external control panel in miniaturized form placed inside the chamber. So you as the clinic owner or a physician, if you want to use it yourself, you don't need an operator. You should be able to operate it yourself. And that's how we designed it. I mean, if it requires two people, time is money, you're wasting your resources. So these are some of the features that we've incorporated into our chamber design. Some of the citations. So that's pretty much it.
Thank you, Shah, for an excellent presentation.
Thank you.
HBOT therapy has been around for a while. It can be incorporated in a lot of practices, and later we'll talk about what level of practitioner can use it, if there are limits of the pressure that different levels of providers can offer. But it's something that I've used in my training in burn therapy. I've used it for wound healing, and it's a very, very effective technology.